Hello, I'm Kyle, and I'm a patient of Blanton Chiropractic. I started coming here about 4 months ago, and I was having extreme knee pain. I was told by the orthopedic surgeons that I needed a knee replacement. And I also have rheumatoid arthritis, so I was having a real struggle. I could bend my leg 37 degrees the day that I came in here. Now my range of motion is over 100 degrees. And a matter of fact, I work in the hospital as a registered nurse, and I had one of my fellow nurses who I hadn't seen in a couple months walk up to me today, and they asked me if I had finally got my knee replaced. And I said, no, I found an alternative, and it's Blanton Chiropractic. So.
Hey, joining me this morning from Blanton Chiropractic is Dr. Jim Blanton, and you brought along one of your patients with you.
Yes, we brought Hank today. He's going to talk about the great results he's had with his knee.
Yeah. Well, to start off with, what kind of knee pain were you having? Were you having trouble even walking?
I was having a lot of trouble walking or doing stairs and standing. I was close to bone on bone. And so, yeah.
That sounds painful.
It was.
Okay. So then talk about, because I know this is Knee Pain Awareness Month, but you obviously were having pain year-round. What I guess brought you to Dr. Blanton's office?
Well, my wife had seen an advertisement or whatever on it, and so she thought, oh, this would be great, and she called and set up an appointment or whatever, and we came, and he had taken the exams and goes over the treatment plan and everything with us, and so we did that. I started last November. How
soon did you notice some results?
It was fairly quick, I guess, but it would be like playing Mother May I. It seemed like I'd go forward and go back a step and go forward and back a step.
And I'm sure, Dr. Blanton, that's normal. There is no quick fix.
There is no quick fix.
Yeah.
At any given year in the United States, there are about 600,000 knee replacements done every year. So what are we looking for? We're looking for people like Hank that are, before they quite get to bone on bone, or maybe they've even been told they're bone on bone, but not quite there yet. We're looking to be able to help people that are not wanting to get knee surgery.
Right.
So we're trying to help people. Now, some people obviously have to have it. But we're looking for people that don't want that as their option, and so they can get great results like Hank did.
Well, that's wonderful.
Without it. So.
Well, I see you brought in, this isn't Hank's knee, is it?
No, not Hank's.
Now, talk to us a little about what you did to his knee and helped him out.
Well, we have a program that what we do is when you come in, we're trying to find out, number one, if we can help you with this problem.
Right.
So we take x-rays of both knees, we do orthopedic tests of both of the knees, and then after looking at both of those, if we think we can still help, then we do a full knee treatment on that knee in the office that day. And then, you know, I tell everybody, you already know this, I'm not the good Lord, so I'm not expecting 100%, but if we can get you on that first visit just 5, 10, 15% better, so we have the patient, after we work on them that day, test drive it up and down the hallway to see how they feel, and then we recheck the range of motion to see if that gets any better. So if there's no improvement on that first visit, then we can't take you for care. But if we can get some improvement that first visit, then that lets us go forward.
So what kind of things do you do to the knee area on that first visit?
We do what's an adjustment on the knee, because a lot of times that kneecap will be out of alignment.
Oh, that looks painful.
Yes, it can get out of alignment. So one side of the muscles are too strong, the other side are too weak. And then we do a muscle technique that is able to get those muscles to start balancing back out like they should be. And then we can decompress the knees, and we use lasers and lights and different things on it to be able to get them better.
Oh, wow. That is amazing. Okay. I know that, Hank, are you still getting some adjustments?
Yes, I'm still in all the treatments and stuff. And as far as, like, you were asking on progress, it was like 2 weeks ago we went downtown to the marquee theaters, and the escalators were out. So that's a pretty good set of steps.
That
I
is.
used to go up steps one at a time and be really supporting my upper body weight on with a handrail.
Hanging on.
I walked up the flight of steps and at the end of the movie down without even touching the handrail and stuff. I can do
amazing.
stairs, I can walk further. I'm not in the pain that I'm in. I can still feel it a little bit, but it's a progress here so
That's
it's
great.
step by step.
Well, before we let you go, do you have any specials right now?
Yes, we're doing the full, it's a gift certificate,
Okay.
which gets you the full first visit, which includes x-rays, orthopedic tests, and that full first treatment on one of your knees to be able to see if we can help. So the ladies are at the office right now. Give them a call on the phone number that's on the screen, and they're waiting for your call. So don't put it off, and don't continue to suffer if you don't have to.
Right.
Like if Hank's wife had not called us, and Hank came in, and he's been a wonderful patient, then where would he have been now?
That's wonderful. That is.
Exactly.
Well, Hank and Dr. Blanton, thanks so much for stopping by and sharing this with us.
Oh, you're welcome.
Thanks for